What if I told you guys that the choices you make today could actually rewire your brain for the rest of your life? Hi everyone, welcome to our show, Brain Health Solutions for All. I'm Candy Cortes Jose.
Elvin Rodriguez Perez. In our first episode of Brain Health, Addiction, and Community Solutions, we're diving into how our brains work, how substances can affect them, and what we can do to stay healthy.
We've got two amazing experts to help us understand it all. Dr. Dziwe Ntab works in emergency medicine and public health, and Dr. Benjamin Clark studies addiction and helps people with recovery.
We're going to let them introduce themselves so you can hear about their journeys, their work, and why this topic matters. Dr. Ntab.
Ntaba, yes. Hi. And thanks for inviting me to the show. I'm Dziwe Ntab. I'm an emergency physician. I work at the University of Minnesota Medical Center. I've been working in the ER for almost 25 years now. I also have a public health background. I've done some global health work in different countries overseas, and then most recently, over the last 5 or so years, taken a particular interest around mental health and addiction locally here in the Twin Cities area.
Thank you. Dr. Clark, take it away.
My name's Ben Clark, and I'm not a medical doctor, but I'm a neuroscience doctor, which means that what we do is we study how the brain is actually working. And my background was I was actually thinking about being a medical doctor, and one of the things that I did when I was at the university is I got a summertime job working in a lab, and I just really got more and more excited about the work that I was doing in the lab, because what we were doing was we were using these fluorescent dyes to make the neurons, the brains in your cell, light up. And when I started looking at those through the microscope and just seeing these really gorgeous cells with these branches all over, shining in bright reds and greens, I kind of just got hooked. And then I started thinking more and more about going into neuroscience. So I took classes that were devoted to that, and then finally went to graduate school and worked in a lab for a long time, where I would actually record the way that these neurons worked by looking at their electrical spiking, because these neurons have electricity that will kind of activate them. And so I would put a little electrode onto one of the cells and record from them. And I did that for a long time, and then I got my graduate degree, and I slowly shifted out of that because my kid was born and I needed to make some more money. And then when I got the opportunity to start to work with people who were actually out in the community, I was really excited about that, because I had played music for a long time as a youngster, and had a lot of friends that really struggled with substances, and some of them actually unfortunately didn't make it through that struggle and ended up dying from overdoses. So when I was given the opportunity to actually go out in the community and talk to people that were struggling with substance use and bring the neuroscience that I had learned about to help out kind of put things in perspective for them on what was happening in their brain, I was really excited to take the position. So I've been doing that for about 5 years now with the medical discovery team on addiction at the University of Minnesota.
Okay, let's start with the basics. What does brain health really mean, and why is it important for young people?
I can take a stab at that in terms of what it means for me. I remember, I think I was in college when I first took a class on neuroscience, and I took a class called Brain, Mind, and Behavior. And that taught me that, the brain is obviously an important organ, right? It hosts the mind, what we think of in terms of psychology and critical thinking, and then it also drives the behaviors in everyday life. And that connection of brain, mind, and behavior, struck me at an early kind of career stage as something important to understand. And then when I went off into medical school and then trained in emergency medicine, I started to see, these behaviors that were driven by changes in the brain. So when we think about addiction, we think about how substances affect and alter the brain in ways that explain some of the behaviors that we see with people struggling with addiction. So when I think about brain health, I think about that kind of connection, brain, mind, and behavior. They're really all connected, and in order to understand behaviors, oftentimes, or at least for me in my practice, having a good understanding of what that disease process is doing to the brain is really helpful. So when I think about brain health, I think about well-being, and then what are threats to that well-being, and when it comes to substances and addiction, that's a particular issue of brain health and brain disease.
And we don't really completely understand the neuroscience behind it, but the reason that it seems to be so important for young people is that we do know that young people's brains are still developing a lot, and they're still changing drastically from now until even like your early 20s. And we're not sure why, but there is a lot of evidence to say that some of those really negative long-term effects that these substances can have end up being more dramatic and problematic for people that start using them earlier on in life. I think Dziwe would agree with me on that. We see much poorer outcomes when people start using these substances at a much younger age. So that idea about why health is so important as a young person, it's really your brain is just so magically plastic and able to change so drastically, and anything that you're putting in there is going to lead to how it's going to change.
How do drugs and substances affect the developing brain differently than the adult's brain? Differently than the adult's brain.
I would say that we're at least from my perspective and my knowledge base, we're still really searching for conclusive answers about that. But like I said before, one of the things that data does seem to suggest is that if somebody starts to use these substances when they're, say, in their late teens, and then let's say they even stop using for a while, they're more likely to develop a substance use disorder problem or an addiction to those substances than somebody who were to, say, start using these same things but at a later age, like say in their late 20s. And our guess is that it's partially because the brain is just still forming so much in those teen and early 20 years. But Dr. Ntab can probably speak more on that.
The way I think of it is probably on simpler terms. We all think of people going through growth spurts, right? And around junior high, early high school, that's very visible. Their bodies start to change. They, sometimes over a summer, people can grow an inch or two. There are similar growth spurts in the brain that happen between the ages of, I think, 11 and 25 or so. So that's what we talk about. The developing brain is, one of those growth spurts, right? And like Dr. Clark is saying, if you introduced substances, toxic substances, some legal, some illegal, those can have long-lasting effects on that growth spurt in the brain, right? And if somebody, for example, starts using substances during that growth spurt, let's say opioids or fentanyl in particular, their chances of dying of an overdose increase, they like double over a lifetime compared to if somebody started using that fentanyl at the age of 30, say. It's just the long-term consequences during this growth spurt or developing brain period are, we're still understanding why that is, but we see the outcomes of how it's important.
Do you two know what fentanyl is?
Yeah.
Okay,
No.
because I just want. So, do you want to explain to her? Because you were using fentanyl as an example.
Yeah. So fentanyl is a growing problem in our communities nationwide. The most obvious consequences of that are overdose deaths, people dying, preventable deaths, far too young. The fentanyl is part of a class of substances called opioids that are related to heroin, morphine, prescription medications that people take for pain relief when under, say, medical supervision. The issues people run into, even under medical supervision, but especially if it's using a substance like fentanyl or an opioid outside of a medical setting, there's a lot higher risk of lasting damage to the brain and a much higher risk of addiction. So that's one example of how a substance can affect the brain.
And that one is particularly dangerous because if you take too much of it, it can make your breathing stop. So that particular chemical actually interacts with the part of your brain that's keeping us breathing this whole time that we're talking. We're not really thinking about breathing, right? We've kind of got an automatic pilot that's doing that, and that automatic pilot slows way, 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 way down when something like fentanyl is being used. And one of the scariest part about the fentanyl is it takes such an amazingly small amount for it to become something really dangerous. And that's kind of why Dr. Ntab is saying medical people who are able to control like the amounts of it, yes, that can be done, but when it's out on the street and you don't really know how much, it's just there's not really much room for error between that high and that death. So.
Yeah.
What made you want to study or work in this field?
Working in the emergency room, we see so many folks struggling with both mental health challenges, and then oftentimes people self-medicate, and that leads to an addiction. And with the fentanyl crisis evolving, it just we started seeing more and more overdose deaths. We started seeing more and more patients with a complete lack of control over their lives. The harms that are associated with an addiction, say to fentanyl or any substance really, it's like people are living in a horror movie, it seems like, based on the stories they describe. Harms can include social isolation. They might get kicked out of the house because their families struggle with how to support somebody with an addiction like that. Other harms, they might get in trouble with the law because these addictions can be very expensive. People, once a brain changes to the point where it depends on a substance like alcohol or opioids, people will do things that they never thought they would do before. They might start by taking a few pills, and then a few weeks later they need to take a handful of pills, and then a few months later they need to stick a needle in their arm in order to meet the demands on the brain of a substance as potent as fentanyl. So people put themselves at risk for infection, for traumatic injury. They can drop out of school. They can lose their job. seeing these stories told to me by patients who are struggling with this really helped drive my interest now and really focusing on, having conversations like this, promoting awareness of the risks out there. But then there's also medications that we can offer for people struggling with addiction that, myself as a doctor representing a health system, we need to improve how we take care of patients struggling with addiction. So one of my interests is making sure that every patient who comes in who needs medications to stabilize this chaotic process in their lives has that available.
Dr. Ntab, we've worked all over the world. You worked all over the world. What lessons from your global health work can help our community here?
Yeah, it's interesting. So the early part of my career, I was doing a lot of work in countries like in East Africa and Burundi and Rwanda. These are both post-conflict countries, meaning they emerged from kind of brutal wars and violent conflicts. I also worked in Liberia and West Africa around Ebola response a little over 10 years ago. And these were communities that were struggling with, poverty and then stigmatized diseases or, infectious diseases like tuberculosis or HIV. If people don't have the medications they need, they kind of waste away slowly. And there's people who don't understand the medical disease process that they're going through. So a lot of times community members would, kind of shun somebody struggling with a medical disease. The solutions that we found were really effective in other countries like that is to start educating community members and identifying folks within the community. Sometimes they're a patient who's been treated with medication and their life is saved. They become some of our best ambassadors to spread the word about something that's difficult for people to understand, like HIV and AIDS, say.
And that's the way it is in the recovery community here too.
That's exactly the comparison that I see with another misunderstood, stigmatized disease right here in Minneapolis and in the U.S. We have all these resources, but very similar challenges when it comes to reaching people who are kind of pushed outside of society, to the margins of society. And I think the lessons from the global health world are, there are some low-tech, low-hanging fruit solutions by empowering community members with knowledge and with resources, like pay somebody to help their neighbor. That's a lot more effective than an ambulance driving out or a doctor trying to make home visits or street outreach. So I think community empowerment and community awareness and education are a huge part of the solution that we're facing, or to the problems that we're facing locally.
Dr. Clark, you started in lab research and now work directly with people in recovery. What motivated that change, and what have you learned?
I guess that at this particular point in my life, and it changes over time, but at this particular moment in my life, it was really important for me to feel like I was helping out with the community that I was in. And I kind of alluded to the fact that I live in this neighborhood where we're recording this. And I had a lot of friends that had struggled with addiction. And so for me, it feels like I can personally help out more people by doing what I'm doing now and working in the community than I could if I was working in a lab. Other people who are really, really insanely smart might be able to develop something that will shatter the world's, treatment of substance use disorders. But for me, it just felt like I could do more good going out and working with people.
How do community partnership help improve solutions of addiction and brain health?
Well, I think kind of tying back into some of what Dr. Ntab was saying, the community, there's a couple things. One, the community is an enormous part of your life. And so if there's going to be a disease that's really drastically changing your motivations and what's important to you, I think it really becomes important, if you're ever going to see the other side of that the whole community is going to be engaged in kind of helping you come back to it. One of the things that we see a lot with people that have substance use disorder is kind of a feeling that they're not part of that overall community. So there's an isolation, and when they're not isolated, there's a community of people that felt like they were isolated. And so I think that having a community that can come back and start to help pick those people up becomes really important. And then in addition, I think that having a group of people, so when you say community, you mean like there's all sorts of different kinds of people that make up a community. So by having a community partnership, you're not just going to have, say, like an emergency room doctor who's going to be solving the problem, or just a scientist who's trying to solve the problem. In addition to that, we can work together, and people who have lived experience, who know some of the things that, frankly, Dziwe and I don't have or at least I don't have firsthand experience in a lot of these things of like being homeless, or the extent to, say, the addiction or substance use disorder has ravaged a person's life. I've had my own struggles with some of those things, but I think it becomes really important to partner with the community so that we have people with lived experience who can be able to relate to the problems that these individuals are having. And to be honest, without the help from everybody, it's really hard to see how this will end up working out, where somebody will be able to get better and have their life improve in a way that their quality of life improves too. So I think you need community to do that.
Yeah, I would echo all of that. And, I think the part of the challenge with mental health and addiction in particular is a misunderstanding. We talked about, the stigma. If someone doesn't understand something, they might quickly judge somebody or try and exclude them or shun them. But that only drives the disease process, right? If someone is feeling really bad about themselves or really bad about something that happened, and they're leaning on something like alcohol, say, to not feel so bad about that, if they're starting to get, negative or judgmental vibes from the community that surrounds them, that's just going to add to this
Cycle.
Yeah, this vicious cycle.
Mm-hmm.
But if more people in the community, and I include my colleagues, if more doctors and nurses, along with more people in the community, had a better understanding of this disease, this medical disease process. If you can link it to changes in the brain, no one really wants to live a life of addiction, right? They may want to start, getting high at some point or self-medicating at some point. But once that changes into a brain disease, no one wants to go through all that isolation and the harms and, run into the law. And if we can better understand that this is someone struggling with something that's treatable, then we can treat those people better. And if we can treat those people better, then they're a lot more likely to ask for help, seek help. One of the biggest things in the emergency room is as long as I've been practicing, and as long as people can remember, we haven't done a good job of treating people well when they come into the hospital, with problems with substance use and addiction. So if we can treat them better, if we can make it a more welcoming environment, then people are more likely to come in and say, yes, I need help, and if you have medication to help me, please get me started. So, we talk about terms like stigma or judgmental attitudes towards folks. I see how that gets into people's body and how that drives disease, and then how that also contributes to some of these bad outcomes of addiction. So that's a community centered solution where if we can spread understanding like you guys are doing with this show, we can really make meaningful impacts in helping people get better.
Why is equity so important when it comes to mental health and addiction treatment?
That is so I guess one answer that I would give to that is that mental health and addiction treatment can be absolutely devastating to a person and to a family. And for me, there's really no room for not having equity when you're dealing with something that can really, really be that devastating to a person. So everybody deserves to have top quality treatment and top quality help when they're trying to deal with either one of those problems.
Mm-hmm. Yeah, and from a public health standpoint, public health looks at populations, right, as opposed to medicine, which looks at individual patients. And when you're looking at populations, you're counting, how many people in this neighborhood, say, are struggling with a particular condition. So when you're talking about equity, you're looking at different outcomes of a disease like addiction or any medical condition, say, and how one zip code might have 5 times as many bad outcomes as another zip code. So equity is trying to balance those scales. So no matter which zip code,
unfortunately not been balanced,
which have been
to this point,
which have been tipped in many ways. But the nice thing about focusing on equitable solutions is when you look at those, say, zip codes or those imbalances, you really get a good understanding of what it is that drives that, right? I mean, if one zip code has so many more people struggling with this, if you focus some attention there, then you can really learn a lot more about the disease and learn a lot more about the interventions. So that actually is a benefit for everybody. I think of equity as opportunities to learn as much as you can, because you're looking at a high burden of disease, and translate those learnings across the board.
You both work with people who are homeless or from communities that don't always get help they need. What are some of the biggest challenges they face with addiction, and how can we help?
That's another really, really, really tough question. When somebody's unhoused, a lot of those things that are stressful and might bring somebody down become even more prevalent. And we know that these stressors have a tendency to lead to somebody having a harder time with addiction and substance use disorder. So when somebody is unhoused, it's like dumping even more of a problem on top of it. And then, as Dziwe was saying, that this vicious cycle can start up where now they're in a position where it's cold outside, I don't have anything to eat, I feel terrible. Is there anything that will maybe just help me just for a little bit? Which can become very, very tempting to then use again, and definitely very hard to actually stop use. And unfortunately, a lot of times in these, so I go with an organization called Twin Cities Recovery Project to these encampments where there's a lot of unhoused people. And unfortunately, in those encampments, there's typically a lot of opportunity to use these substances, which also makes it even more hard to stop using when it's just around you everywhere. So those are some of the challenges that people who are not housed face when they're trying to actually stop using. First, they don't have the same community of support that hopefully somebody who is around their family and their family is not using substances, let's say, they don't have that same support. And then added on top of that, there's just the constant stress of not being able to have your own home, not being able to have your own bed to sleep in, not really knowing where you're gonna be tonight, because even if you have an encampment, they might come and break it up at some point. The city might come and break it up, which means that you don't really know where you're gonna be that particular night, and all of those things are enormously stressful and can make it even harder to kick an addiction. Can you any points that you want to add?
You know, this question is a personal one for me because one of my best friends had been homeless for a while in Central Park in New York City. For mental health reasons, not so much for addiction reasons. But I found him at a later stage in his life where he was a war refugee from Burundi, escaped to New York City, was living in Central Park for a while, taught himself English, got himself enrolled in these fancy graduate school programs, and he's one of the most inspiring people I know. He would tell me these stories about how he was treated when he was homeless in Central Park. And it was, of all the challenges he had gone through, that was one of the biggest ones, just that sense of isolation and that sense of like people, no one wanting to talk to him. And that's given me a different perspective on people who are struggling with homelessness, who are unhoused, unsheltered. And I think if we can understand that people, no one wants to be living on the streets, right? There's always quite a number of reasons that lead up to that, usually around untreated conditions like mental health and addiction. That's a very common reason why people end up in the streets. So if you think of this as, it's our problem as a society that we haven't been able to figure out how to help folks in need, then that can kind of change how we see folks, how we treat them. And I think that can be as big a help as a lot of other things that they need.
We see a lot of open-air drug use in Minneapolis. What approaches can help reduce public drug use while keeping people safe and supporting their health, recovery, and dignity?
Yeah, that's hard not to see. I mean, just on the drive over here, it's a very common occurrence, and there's a lot of people asking that question. A lot of schools of thought. One is more policing function in terms of enforcing the laws around where people can live in public. Other conversations are around, let's get to the root causes of why people are using in the first place. So I kind of land in that, offering treatment for both mental health conditions and addiction as a way to, help people meet their goals if they want to get off the streets. And I think most people I talk to do. If they want to stop using substances, if they want to regain control over their lives, let's make the treatments available. Let's make the medications available. Let's make the resources available. Recovery housing or transitional housing is something that we don't do well across the country.
And it's getting even harder here now.
It is, yeah. So
a lot of the recovery houses are having to shut down based on some of the new policies.
Yeah, it's a very difficult time.
Yes.
But I think having that perspective of, what failed this person who's living on the street, or what led to them living on the street? I can relate. I think of my friend in terms of, it's easy to identify how he ended up homeless. And I try and have that same perspective, either driving by folks, on the way here, or seeing a lot of these folks in the emergency room as well.
What are some signs that a young person might be struggling with substance use?
Yeah, we see folks, younger and younger folks, coming into the emergency room struggling with substance use. Even some folks in junior high, they might start experimenting with pills out of the medicine cabinet, or gummies from a friend or something like that. I see them much later in the process. I see them once they start having physical or psychological effects from substance use. But from the stories I hear from parents, from older family members, sometimes people are mistakenly thinking that a substance can help them feel better. There's some people who are just curious and want to see what all the fuss is about getting high. There's quite a large number of young folks that I see in the emergency room who are feeling really sad about something, or really struggling with a particular, and so it's like an escape. They're trying to escape a problem, but they're entering into a new level of risk, right? Or they're adding problems rather than taking away problems. So, in terms of, signs that someone might be struggling, someone feels sad, they're not showing up to class maybe, or, I would say just check in with people's well-being, and if they're not doing well, that might be a sign of someone who's at risk for substance use.
If we see a friend or classmate struggling with drugs or stress, what's the best way to help without making things worse?
That's another really, really tough one. I guess one thing that I would say is to not close them off, but then at the same time not to try and take that entire load on yourself. I know it probably doesn't sound very, I sound old now, but usually with problems these large, it's a good idea to have an adult help out to finding solutions to these problems. As Dr. Ntab said, sometimes people are self-medicating to deal with other issues that are going on in their life. And in those particular cases, it really, really becomes crucial to have some medical professionals to be able to help. And the other thing that I would just like to kind of remind of a topic we talked about a little bit earlier, these drugs are just so ridiculously dangerous now. Like when I was a kid, there was not a fentanyl out there, where it was just literally a speck would kill me. And so it's really becoming more and more dangerous to even dabble in at this point in time, because you just really never know what's inside whatever it is that you're being offered. So I guess the two things are, even though it sounds like what you don't want to hear, bring an adult in, be there for the person, but don't try and shoulder it all. Because it's just, it's very, very, very complicated problem, and you can still be there for your friend and have, you know, an adult play another additional role on top of that. Do you have any advice?
Yeah, no, I agree that it's getting more and more dangerous with some of these substances. They're very unforgiving. The people, especially kids and young adults who get caught up in this, a lot of times they don't foresee, it's hard to predict what types of risks they're taking on.
And not even the short-term risks, which can be life and death, but those long-term risks that we kind of both alluded to, like the changing your brain in a way where all of a sudden you don't even understand why, but you seem to forget what you care about. You seem to forget that you care about your friends, and you forget that you care about playing football, you were saying, or that you are learning how to play the guitar. You forget like those things were interesting to you, which is like a long-term problem that is already bad enough, but then to add this short-term problem on with these extremely dangerous drugs right now, it's just, I have a youngster at home, and I just really, really think all the time, like, I really hope that you don't get into this struggling, and I try and share as much as I can about what I experience in my job, and I have even brought my kid volunteering with me when I go to encampments to really kind of try and show what this can lead to, but also that these people are humans too. And so when we're handing out food, there can be like a connection and really understanding, hopefully what's happening with this huge problem. Sorry, I interrupted you.
No, I have a 5-year-old, and I'm already talking to him about the dangers
What are some simple things we can do every day to keep our brain healthy and protect ourselves from addiction?
Exercise and use your brain.
Yeah.
Your brain is just is very, very similar to the muscles in your arms and in your legs. So if you don't use the different parts of your brain, it gets weaker. So the more you can find things that you're really interested in, or even like when somebody's telling you something, one of the things I tell my kid all the time is challenge yourself to find out what's interesting there. Even if it's not sounding interesting to you, like try to figure out what it is that's interesting there, because there's something there. And the more you're using your brain in like those creative ways, I think the healthier your brain is going to be. And then exercising is also phenomenal for your brain. And eating things that aren't just cinnamon rolls.
I would add, there's a lot of power in positive thinking. And the other side of that is you can do a lot of damage with negative thinking. And I think about, the stories that we tell ourselves. Sometimes, people can get really anxious or too worried about something that's not a big a deal at all. But if they keep worrying about it, or if they keep, thinking about the worst case scenarios, sometimes that can affect how we feel. But the opposite of, if you always try and think positively, or if you're worried about something, but you just tell yourself the simple story like, I'm going to work through this. Even if you don't believe it, there's something about that internal voice, that how you, I guess the stories that we tell ourselves about what's going on, you know, that can really affect our mood and that can affect our stress levels, because that's part of like that brain-mind connection we were talking about before. If your mind is preoccupied with negativity, that can affect the brain physically or physiologically in terms of how many stress hormones our brain is producing, and that can affect you know, our emotions in the long run. But a lot of athletes figure this out, you know, in terms of like positive visualization. If you're nervous about taking a free throw in a basketball game, you know, you take a few breaths and you close your eyes and you visualize that ball going in the basket. That's actually a skill that athletes work on, right? And that's partly because that positive visualization helps dial down the stress of something, you know, like a big shot in a game, say.
And it's a daily thing too. I think that's one thing to kind of keep in mind, is that you can't just lift weights one day in 7th grade and then you're done lifting weights for the rest of your life. So every day, just try to challenge yourself a little bit with your brain too.
Yeah.
So you can keep it healthy and keep it growing, you know.
Yeah.
How can schools, neighborhoods, or young people like us help make sure everyone, even people in really tough situations, get the help they need it?
Share what you're learning.
Yeah.
I think that's probably the best way for people your age, is you can share it with your parents, share it with your friends. The fact that you're having these conversations is already huge. You're already like trying to create something for your community to share. So that's already an extreme kudos to both of you.
Yeah. And I would say share what you're learning about the brain. The brain is so cool. It's fascinating. Like you say, we're still, as a scientific and research community, still trying to understand exactly how the brain works. What we do understand is fascinating, and it's relevant. You know, if you're talking about changes in the brain, like how can you use it to feel better about yourself, or how can you use it to be a better athlete, or how can you use it to have more fun in school. I would say be a good ambassador for the brain and brain health, because there's so much to work with, and it's so important for daily life.
Okay, now it's time for a quick round of fire rounds. Ready?
Mm-hmm.
What's a fun or surprising brain fact most people don't know?
I have one that so when I was younger, we didn't even realize how much the brain can change and how plastic it was. So at that particular time, we even thought that you didn't get new neurons ever. So even through the course of me being in this field, we learned that you do get some new neurons, but the most surprising and hopeful fact about the brain that I have come in contact with and seen in a little dish as they're growing out is how much they can change. Just like how resilient they can actually be. And if you decide that you want to learn something, the brain is just phenomenal. It can actually, you work on it and it starts figuring it out. And that plasticity that the brain has, it's kind of a basic thing, but to me, it's the most exciting thing about the brain. It's just how amazingly resilient and plastic it is, and the potential that it has to change.
What's a book, movie, or podcast has inspired you, your work the most?
Probably the book that's inspired me the most is written about my good friend that I talked about, the guy who was homeless and then got himself off the streets, and that's called Strength in What Remains. And I like that title because it talks about, someone who'd gone through so much, lost so much in a war that he escaped, but he had a lot of strength in terms of what was left over, and that was, all his strengths as a person. He's a brilliant guy, very compelling guy. So strength in what remains.
If you could invent one new tool to help people with brain health, what would it be?
You want me to go with it?
Yeah.
One technical tool that I think it would be really great if we had is so we have some medicines that help out with opioid use disorder, but we don't really have very good medicines for some of the other drug disorders that we have. So one thing that would be nice to have is something that would do the same thing with a stimulant that would kind of help people out with their craving for a while as they start to kind of reform their brain and have it get back to being healthy. But the other tools that we already have, like reading a good book and things like that, are pretty phenomenal tools too. So I don't think
I've got a tool I'd like to see. A portable, functional MRI machine.
Oh, that's a good idea. Yeah.
If you could,
like a diagnostic tool that you could.
Yeah.
That would be easier.
Yeah, or even just showing people their brain, the brain activity in real time. The closest example I can think of is like an ultrasound. If you go to the doctor's office or you come to the emergency room, we have a ultrasound like the size of a laptop, and you can look at somebody's kidneys or look at their heart or maybe look at their their baby in the womb, and there's like an immediate understanding of what's going on. Or it kind of demystifies a body part or a body function when you can see what's going on. I wish there was a way to do that with the brain, and then maybe project normal states and disease states so that people could understand, kind of demystify the brain a little bit.
One of the tools that we're actually trying to create at the university would be a tool, we're a long ways away from getting there, but a tool that would basically be kind of like a hat that you could put on that would be able to help somebody who's going into one of those craving starting modes where they could actually put it on and it would actually help to stimulate areas of the brain which would kind of help to quiet those voices. And with that type of tool, then maybe if you could expand that to not only help with drug craving, but with suicide ideation and other things like that, for when a person gets just kind of bogged down and are at a point where they really can go one of two ways, this would be maybe a tool that they could have where they could put it on and that stimulation would help them to pick a more healthy path.
What's a good food to strengthen your brain?
I'm not a nutritionalist. I'm going to hand that one to you.
Yeah, I'm not either. If I had to guess, I would say something that's vitamin rich, something like kale.
I had kale yesterday.
Did you? Yeah. Well, look. But the brain, just like the rest of the body, needs a well-balanced diet. If the brain doesn't get certain vitamins, there's consequences for that. So I would say kale.
If your brain could download any skill instantly, like a video game, what skill would you pick?
It's pretty selfish, but I guess I would pick to be able to play like really, really good classical piano.
Ooh.
That's not really going to help the world at all, but I would love to be able to just be able to play the piano really, really well.
Yeah, I'm going to steal that one. I would say some kind of musical instrument. Maybe jazz trombone.
Yeah.
Yeah.
Okay. Wow. Thank you so much, Dr. Ntab. Okay, and Dr. Clark, that was a lot of amazing info in our quick fire round. Now we want to slow down a bit and hear your big takeaways.
What's the most important thing you want kids and people of all ages to remember from today's conversation?
I would say that first part would be that the brain is very, very resilient. And so people who are struggling with substance use disorder, they've had a change occur in their brain that's basically hijacked it and kind of shifted what's important to them. But the brain is also resilient, not only in getting put in that state, but it can also come out of that state. And to remember that there is that hope, and that when you see somebody else who's struggling with something like substance use disorder, remember that there is a way out and a way that they can actually come back to kind of being what they were before.
I think very similar takeaway from me. The brain is an amazing thing. The brain also suffers from some diseases, that are avoidable or preventable or treatable, like addiction. The ability of people to recover and sometimes come out stronger. Like I'm thinking about my friend who struggled with serious mental health issues, to the point of being homeless. That experience helped him become a better person once he was able to get himself off the streets and back into school. He's now one of the most accomplished people I know. I named my 2-year-old after him because I was so inspired by him. And this is somebody who went from a very difficult position, living on the streets, to a widely respected, influential person now. And that's all around kind of the brain and the mind, and like how he had the resilience to emerge from a really difficult process, and be a much better, or be better off because of it, I would say.
And if someone could take just one action after listening to this episode, what should it be?
Try to share what you learned today by connecting with somebody else and talking about it.
Yeah. And try and look at people who are struggling differently, I would say. Try and understand not just their behaviors, what we see, it might be open drug use, but try and understand what's going on in their brain. And I think that can help a lot.
We also want to know how youth like us can make a difference. What's something we can do to support our friends, family, or our community when it comes to brain health and addiction?
Be supportive of your friends, and again, that kind of like I just said before, like share what you're learning about this with the other people in your community, and hopefully it can help to break down some of the stigma that's forced on people that have substance use disorder.
Yeah, and help communicate the risks,
Yeah.
Like you said earlier, Dr. Clark, it's just, the stuff out there on the streets now is so potent and devastating and unforgiving. But coming from somebody like me, it might be easy for young people in particular to kind of blow off like, oh, that's old people talk, say, but if it comes from peers, friends, classmates, teammates, that carries a lot of weight. people will listen to you and the knowledge that you have.
That's an excellent point.
Yeah.
That's way better than my answer.
Yeah, you guys have important knowledge now, and please share it.
Okay. Finally, for anyone listening who wants to learn more or find resources to take care of their own brain health, where should they go? Are there programs, websites, or apps you recommend?
Thank you again for sharing your time, your knowledge, and your advice. We've learned so much today about how your brain works, how to stay healthy, and how communities can support each other.
Okay, alright everyone, remember even small actions like sleeping well, eating right, or checking in on a friend can make a huge difference. Thanks for tuning in to Brain Health Solutions for All. Don't forget to subscribe, share this episode, and join us next time as we explore more ways to take care of our brains and community. See you soon.
Thank you.
Thanks, you too.
Yeah, that's great.